for by accident or being a deliberate act, it's exposed the soft underbelly of the United States. And the problem with the United States is there's a lot of unhealthy people there that are going to be subject to the ravages of this agent. And I don't know how you get around that problem now, because it's been allowed to get in. And you don't go infecting the president, his wife who's now a long hauler, right? She's got that long recovery syndrome, and get away with what's going on with respect to this trade war that they're involving themselves in, and the military movement. And what would be, so there's, they have standard military operations every couple of years, like in Korea, etc. The US comes, the aircraft carrier sort of rolls up, etc. That goes on in the Pacific.
Drills.
Yeah, and it's every 1-2 years they do this, but this time it's been way different. And there are sort of contested islands in the South Pacific Sea. And I'll just say hi to Dr. Fleming in the chat. So actually, Davey, we have someone in the chat right now, Dr. Richard Fleming. He's treated 1,800 patients. He just published the work. And if you had a question about the disease, like the pathology of the disease and how it would progress, you can ask Dr. Fleming. I'm sure he'll be more than happy to answer.
Well, my question would be, very young man like myself, as you put it, susceptibility and risks of actually causing me damage. What's the risk factor actually? And another question I have is about the testing. And this isn't really a question for a doctor, but we all see that this is being used as a control system. Constant tests, constant going to be needing for it's not going to be one vaccination. It's going to be multiple. You're going to have to go in multiple times. Can we all agree that this is just forms of control?
Yeah. So Richard is very much on the side of we should be able to treat this conventionally, vaccines, and the idea of, like you're talking about, that they're going to have to keep injecting you because there's going to be a problem. Let me just see. Richard, are you okay coming to a Zoom meeting and just talking about this? Just asking chat. And like I say, he's got a lot of clinical and research experience. He's based in the US. He can probably answer your questions for this particular issue better than I can.
I got like one. Like, I'm not, because I'm the odd man out. I'm not a doctor, so some of these things fly by my head. I'm just looking at it common sense wise of what's going on in our country. I see the lockdown. I see the social experiment that's happening has far worsened the people than what is happening. And you touched on this earlier with how, I don't know if it was Asia or China, how they didn't lock down and it was a much better outcome for them.
Yes,
and we're at a desperation stage, and the WHO just flipped. They just said the lockdown shouldn't have happened. They now it's a whole different story, but all the channels that said that from the get-go are still suspended.
Yeah, and well, so there's multiple issues there, right? So if you're going around saying viruses don't exist, putting people in danger, Richard, I'm just about to send you the Zoom link for so you can speak on screen. I'll send it to you as well, Davey, and then you can ask directly. So there's the Zoom link. Davey.
I gotta go to Zoom.
Yeah, I'll send you the link. It should just load up as in your browser. Are you at your PC?
Mac.
Yeah, you're at a desktop, right?
Yeah, desktop.
Yeah, so that should.
It's still trucking.
So.
All right. Give me 2 seconds here. I'm organizing a stream too as we speak.
Okay.
Right.
But the questions you're asking are legitimate, right? And I'm, there's the whole issue with the Barrington Declaration, which says just let everything go and let it run its course. I think is short-sighted, and I think the complete shutdown is short-sighted as well. I don't think it's helping anyone except those that are able to buy businesses on pennies on the dollar now because they've all gone bust. And so I'm waiting for. All
right, so I'm stopping Discord.
No, you don't have to. It'll I think it just will be okay. I can hear you. It's just I want to get. Okay, so here's.
Am I on screen or?
No, we can't see your dashing young face, I'm afraid, and neither can I because mine is in Discord. So let me just delete mine from Discord.
Just want to make sure I get all the paraphernalia and my drug den over here. I want to make sure everything is
in place,
is clean and clear. I give you the illusion that everything is just fine and dandy.
I'm sure it's okay. Where's my?
Those are jokes for 3 people that are watching.
Right, so I'm on screen. You should be able to pop on screen. Can you hear Davey, Richard, if you're talking?
Yes, I can hear him. Can you hear me?
Yes, we can hear you.
Good morning.
I know you can hear Evening. Me, but can I be on screen?
Yeah, you just need to switch your camera on. So if you look at the bottom of the browser, you'll see mute, stop video, security, participants, all the sort of normal buttons that you would have to switch your camera on. Your camera wasn't plugged up for Discord either.
Here we go.
There you go.
All right. Good morning or evening, wherever you are.
I think so.
A young man amongst the doctors.
Well, you got that PhD, dude. So
a conspiracy theorist just trying to make his way through life.
So, Dr. Fleming, allow me to introduce to you Dr. Davy Crocco. He has a PhD in busting grifters on the internet, and it's a well-earned degree. And
how you doing, sir? Very nice to meet you, man.
Are you there?
Yes, he's
okay. I heard some of his questions. He was talking briefly about concerns for his age.
Hang on, Richard. You can't hear Richard?
No.
And I can't hear
headphones?
Well, we can see. I can see you.
Does he have it on mute?
Sure. Yeah, just check that you're on. Everything looks good to me. Oh, Davey, your mic is not. I don't see your mic active. So your video is active, but your mic is not. There. Oh, yeah. So your mic, I can see your mic now.
Okay.
Is it working? Just do a sound check, Davey.
Sound check, Davey.
Did you hear that?
I did, yes.
Okay, so I think we're all in place. So fire away, Davey. Let's get to the bottom of it.
Well, I don't know where we were at, but I was just asking the susceptibility of a young man like myself. And yeah, I did mute Discord because of the echo. What do I have to worry about? Because I'm under the assumption that this is more of a controlled takeover using the virus rather than it actually being a virus sweeping the country that we need to worry about. So if you could talk me off of that ledge, I'm willing to hear
it. Right. Reminds me of something I was watching with Crocodile Dundee yesterday on a ledge of a building. Okay, let's see if I can talk you off that. To begin with, it's obviously a virus. Okay, this is a virus. It's a respiratory virus. It is passing around, and it is a pandemic. It's a virus that is both naturally occurring and man-modified. And I think the modifications of that virus increased its ability to infect. In fact, the information indicates that they were specifically going to see if they could enhance the ACE2 receptor attachment of the virus. Now, what their motives were behind that is anybody's guess. You can never know the actual motives of somebody else. Only they know that.
Would you guess maybe population control?
No, I don't buy into that. I mean, that's an awful lot of work for the purpose of population control. Look, there's easier ways to neutralize the reproductive capabilities of a society than trying to go out and develop a virus to infect people. So, I think
what if the vaccines on
right,
the end would have
Davey,
a way of sterilization?
Right, Davey, take a breath. Let me talk, okay? Because I know that I know where you're coming from, and I think that's part of the problem. We have really developed a polarizing discussion about this virus from two perspectives. One perspective it says that viruses don't exist, and so therefore this is what do you call it? A con on people.
I'm not there. I'm not on viruses don't exist.
Okay, and the other one is that somehow there is this effort to produce some type of sterilization or control of the society. Now, my suspicion is that this virus, they nowhere in their wildest imagination thought that they would have a virus that would be as successful as causing health problems as it is. The reason why this virus kills people is not so much the fact that it's a virus, although that is key, but the immune response to the virus. And that immune response has always been the way the body has reacted. There is, in the body's effort to deal with an infection or something in the body, maybe that you put in the body, whether that be bad food or smoking or doing something like that, that increases your health risk, your body reacts to that to try to resolve the problem and remove it. And in the consequence of that, the body develops systems that cause inflammation or fluid accumulation, if you will, and blood clotting to deprive the damaged area from being able to receive adequate nutritional support, if you will, for lack of a better way of looking at that. And so the whole goal is to resolve whatever the offending problem is. And in this case, it's an infectious organism. So if you are like most people, your body will typically react to the viral infection in 3 to 5 days. And that's typically why people feel lousy in that amount of time. And that initial part of the immune response is the T cells coming in, recognizing the virus, the antigen, the virus, presenting it for the rest of the immune system to react to release cytokines, interleukins, like interferon, in an effort to inhibit the replication of the virus and control the disease process itself. However, if you are somebody whose immune system is not well controlled, you're either have a naive immune system so that you're very, very young, or you have diabetes where the immune system is not working well, or you have an immune deficiency syndrome, or you sit on the other end of the spectrum, And this is where our dietary and lifestyle practices are now demonstrating the toll that they're extracting. You have a series of diseases like heart disease, cancer, hypertension, diabetes. The list goes on of what can be referred to as hyperinflammatory or hyperimmune diseases. And this means that your body has adjusted to the idea that it needs to have an increased immunologic response to deal with these diseases. Now you bring in another offending factor like this virus, or we now know that about 12% of people who have influenza any given year actually die from the thrombotic consequences to that virus, and that causes what I refer to as a myocardial infarction or heart damage, and what you probably refer to as a heart attack. And that kills people, and that's one of the reasons why we're seeing these people die, is because there's no what I would consider more appropriate regulation of that immune system. It's been geared up, and subsequently it says it doesn't recognize control as well as it should. So while they were playing around with this virus to see what they would do, it is the rest of society that has produced in a setting where there is so much of this hyperimmune process going on with these chronic inflammatory diseases that we're now seeing the consequence and paying of that. Now, when you talk about your age, I'm not sure that I don't know how old you are. I'm guessing late 20s, early 30s, but that's just a guess, and your screen is frozen up. In that, you know, pre-2000, I was at a university conference, and one of the questions that was asked of me was, what did I think the greatest problem would be in the next century for healthcare? And I said, we're going to have a bimodal society. And I thought that spoke to the problem. And as soon as I said that and the blank stares approached me, I realized I needed to explain that. So what has happened is, as our societies have developed poorer and poorer dietary and lifestyle practices, we have shifted the onset of these chronic inflammatory diseases from our 50s and 60s and 70s down by about 2 decades, so that the onset of these diseases are now beginning in late 20s, 30s, and 40s. And so, and again, you're frozen up, so I'm not seeing any movement on your end, Davey, although I see the box lit up around yours. So what we're seeing is increasing numbers of younger and younger individuals developing these pro-inflammatory states. And as a result,
hang on 1 minute.
Yeah.
I've got Davey hanging outside the room again. Sorry, it's my fault.
Right. No,
he should be joining.
He's just a little catatonic.
Yeah, the Parkinson's set in. So.
Yeah.
Okay, so there's Davey back on.
Hello. Oh, that looks like a different room. Okay. But now I can't hear.
Yeah, you need to enable your mic, Davey. Your mic's not on.
In there.
Yeah, that's good.
That's all right. So hopefully you got all that. I'd hate to bore everybody listening with doing that twice.
There's some feedback, Davey. Psychedelic.
All right. So hopefully everybody was following along with that, and that's really what's going on with people. It's, you know, you can't tease out. And now I'm reverberating.
See if...
Is that on my end? Because I'm just on my phone.
Yeah, I think it's on your end.
Okay, there we go. So you really can't tease out when you say, are people dying from COVID or with COVID? Because the fact that the virus itself, you know, we kind of think of it we have a tendency to want to separate these things out, but you can't. The virus itself is the thing that's promoting the hyperinflammatory response, and it's that immunothrombotic response that I keep now trying to reiterate to people, that is the actual cause of the blood clots and the fluid accumulation, which is the fluid accumulation is most problematic in the lungs when people are trying to breathe, because it produces something called acute respiratory distress syndrome, and that's what led to so many people reverberation. Being put on ventilators, and
We've got a lot of reverb somewhere.
yeah, and they shouldn't have been put on the ventilators to begin with. Still a lot of reverberation.
Yeah.
That can't be coming from mine because I'm not even talking.
Yeah, you sound good when you're talking. I don't hear reverberation on your end, and I don't hear it when you know, like right now.
I'm switching my mic off. Just
Okay.
let's see if we can just track down where it's coming from.
That sounds clean. And now your mic's off altogether. So okay, can't hear you. Okay, but you can obviously, I guess, hear me. And it might have been that there were two different ones coming in on Davy's side, because now I see an icon that shows his name with a red /through mic. So, Davy, can you hear me?
Absolutely clear.
Okay, perfect. Okay, and that sounds good. So, Kevin, you may or may not be good to turn yours back on. So, it's this inflammothrombotic response, and in fact, that's really what we were looking at. The original theory that explained this, I presented at American Heart Association meetings in 1994, and at that time, I was a member of the council for lipids, and I was one of the reviewers for lipids. And so if you were trying to present an American Heart, I was one of the 4 people you had to get by with the submitted manuscripts, abstracts that you wanted to present, and we would determine who did and did not present at those conferences. But I presented in one of my lectures during that conference this concept that heart disease wasn't just a disease of cholesterol, although cholesterol plays a role, because it's one of the things that causes this inflammatory process to gear up. It's this inflammatory process in the wall of the arteries that prevent the arteries of the heart from relaxing and dilate to increase their blood flow upon demand. That's actually what coronary artery disease is. It's not a narrowing of an artery, although a narrowing of an artery will also impair the ability of the artery to relax and increase its blood flow, and that's called flow reserve. So it was first presented at that point in time, and the theory, which Kevin has seen in a schematic and a diagram, shows how at least 12 different factors, including infectious diseases, can promote or precipitate a worsening of that inflammatory response. And you have to treat both the infection and the inflammatory process to get by with that. So your age doesn't protect you at this point in time, presuming that you're living a dietary lifestyle, obviously, that the vast majority of the planet lives. In heart disease, we frequently cluster people out into depositors and clotters. And the only way you know what somebody is to see how long they live. So a depositor is somebody who deposits this inflammatory process and impairs the arteries, and the clotters are the ones that actually form blood clots and cause that final massive heart attack. In fact, half the people find out they have heart disease by dropping dead of it. And what we do know is that the older you get, the more likely you are a clotter, because you've had plenty of time to deposit it and it hasn't produced the problem. And that clotting is part of this inflammothrombotic process that's killing people with SARS-CoV-2. And in fact,
sorry to interrupt.
Sorry about that.
But there's a critical factor that we could sum up, I think, in 2 words. Fat, unfit people are the ones that are going to get hit hardest. And right now, there's light at the end of the tunnel, because we understand.
Maybe elderly.
Say that again, David.
Elderly, maybe.
I can barely hear you, but if elderly are at risk generally, just because they're at risk from heart disease. But there are some. The problem with this disease is it seems somewhat random in who it takes. at the younger age, but the mechanism seems to be the same, which is this clotting getting out of hand. Now, what exactly? Why are some 20-year-olds dropping down dead with it? I'm not sure I could answer that. I don't know if Richard can, but like I say, every time we check, they go through autopsy. They have this clotting disorder, and it also targets the brain, and there's a kind of respiratory collapse. So they at the beginning of this, when they were trying to take people off ventilators, right? They have to try to get the people to wake up and start breathing by themselves, and the virus itself is going into the brainstem and messing around with those neurons which initiate your breathing. And I think that was a big factor in why the deaths were so many at the beginning. But I think we're on top of that now.
Yeah, and part of it is the fact that, let me step back. It's easy to put somebody on a ventilator. Any fool can learn how to intubate somebody and put you on a ventilator. Getting you off a ventilator is not only science, but there's some art to it, because the criteria for what works and what is successful keeps changing. And as a clinician, I can tell you that there is a huge skill set that is simply looking at a patient. It's not very objective, unfortunately, of looking at a patient and seeing how they're reacting and seeing how they respond to a test to extubate, to remove them from the ventilator, and then using that knowledge to determine who you can and cannot get off a ventilator. And it's very challenging. And in the setting of this virus interfering with the respiratory hypothalamic mechanisms. And Kevin, you would probably remember the exact centers better than I would as a brain specialist. It makes it more problematic. And then putting the people on the ventilators were set incorrectly to begin with. They were actually getting twice the tidal volume that they should have. Several published studies in the medical literature in a journal that I no longer consider that credible, but it was at the time, showed that the tidal volume for people with ARDS is half of the tidal volume that you would normally put somebody on a ventilator. And these larger tidal volumes stretched and produced more inflammatory changes in the lungs, making the inflammation worse in the lungs and further compromising the ability to get them off the ventilator.
So actually, there's a question that people were filling up in my Discord, Richard, which is hydroxychloroquine, yes or no?
Okay, well, the problem is that vast majority of research studies that have been published on hydroxychloroquine have no objective measurable outcome to determine whether it does or does not work. There's all sorts of theoretical mechanisms behind it. What we saw in the 1,800 patients that we had was that somewhere between 67 to 100% of the outpatients who were treated with an aminoquinoline, be that hydroxychloroquine or primaquine, demonstrated improvement, in contrast to only half of the people in the outpatient setting who received nothing. Now, the problem with that is that they didn't measure objective outcomes in the outpatient setting, so the question is whether it was that or not. What we know from our inpatient studies where they did have FMTVDM to measure it was that there were three basic groups of patients who got better in a very short period of time. There's some question about whether there's some type of priming of immunologic response with aminoquinolines that may improve and shorten the amount of time in the hospital. And that's fascinating, but it is also true that 2 of the 3 regimens did not include an aminoquinoline. And one of those mechanisms, one of the things that we saw that, we can talk about very quickly, is that it does appear that individuals who were pre-treated in the outpatient setting with an aminoquinoline, and it's also true that primaquine was better at this than hydroxychloroquine was, seem to respond faster to methylprednisolone. They didn't seem to. They did respond faster to methylprednisolone when it was first given to them in the hospitalized setting. And that evidence in and of itself suggests that the reason why Trump responded so rapidly was probably that he had some residual effect of the hydroxychloroquine, that when they gave him the methylprednisolone, he responded. Now, we should not have had, now after the fact, everything's always more obvious after you do the research. After we completed that study, which was only a month ago, month and a half ago now, I went back in my brain and I said, wow, when I was an intern and a student and a resident, and we had COPDers come in with a pulmonary exacerbation due to either a viral or bacterial infection, one of the very first things that we did with these people is we loaded them up with IV salumedrol, which is methylprednisolone. You just have to burst them real hard, and the trick is to taper that down so that you don't have complications due to the steroids. And to a person, these people respond significantly. If you didn't do it with the steroids on board, these people did not get that much better, that much faster. So
let me, because there's a degree of technicality coming into the conversation that it's probably each one becomes an essay by itself. So one of the questions that Davey asked me was the vaccine, and I'm saying don't take the vaccine. From my perspective, it's scientifically impossible to do all the study that they need to do.
Yeah. So the vaccine, to begin with, one of the things that the vaccine basically says is that we don't have an acceptable treatment regimen, so therefore we have to punt to, let's see if we can somehow prevent it. Vaccines don't prevent the development of a disease. They prime your body's immune system to be ready for something in advance. And one of my concerns about the vaccine is the fact that if, in fact, the reason for the cause of death is what I'm saying it is, this inflammothrombotic response, and you vaccinate people that are already predisposed to a hyperimmune response, all you've done now is put them at risk of having that same inflammothrombotic response that's already been responsible for the deaths of so many people. So one of my major concerns is the fact that this vaccine, without any thought given to the fact that it may be producing increased vulnerability in people, is the fact that it's precipitating the very thing that's causing deaths. Number two, I'm unfamiliar with, and anybody out there wants to correct me, please let me know. I'm unfamiliar with any successful vaccine for a single-stranded RNA virus yet to date. Now, that doesn't mean it can't happen, but SARS-CoV-2 is a single-stranded RNA positive or sense virus. So it's unlikely that they're going to develop a vaccine anyway. And I think what they're going to do, because there's money involved in it, is throw everything at the kitchen sink or at the wall that they can and see if something will stick and use that to sell to people. So I think it's dangerous to begin with. Number two, I think they've done no real research or the type of research that needs to be done, which just boggles my mind given the history of disasters that have happened. Number three, I don't think that the vaccines are an attempt to control or manipulate the species population. I think that's just a side branch of discussion that should just be put aside, because it's moot. It has nothing to do with the scientific conversation of the testing of a vaccine to determine that it's safe and effective to begin with.
David, you had a question?
Yeah, I was just going to say, I'm not well versed in RNA or mRNA vaccines, but I have heard of and read some documents on DARPA working on these.
Yeah. This is all very new technology, and that's why I'm saying they can't test it sufficiently. Well, basically, they test it
as more in this light in our bombastic U.S. I mean, you're out of the U.S., Dr. Fleming, right?
Correct.
He's in L.A.
Is that part of the U.S.?
We're slowly branching you out till it gets to an island, and then maybe we can invade. I don't know what the scenario there is.
Sorry, where are you at, Davey?
I'm in New York.
Okay.
Same deal. It's the coastal cities.
Right. Well, I'm a scuba diver, so I could swim for it.
I think the U.S. is a way more bombastic under the Trump bubble, where it's a lot of talk about a vaccine in a very quick time that isn't reasonable by all doctors' accounts, all accounts of anybody in the medical field. And this still doesn't seem to worry a lot of people, which is very frightening.
Well, I think what's frightening is the massive amount of misinformation that's out there. And Trump is a politician, and so
and actor.
Is he?
Well, a bad one.
Not a good one. Not a good one.
He's a politician and actor, but he is the puppet in place right now that's pushing Operation Warp Speed. So he is the guy that people, like it or not, are getting their information from.
Well, as best I can tell, there's nobody solidly putting out information based upon science, and that includes Fauci and all the rest of them. Because as Kevin and I talked about the other day, Fauci has so much vested interest in the outcome that
you were on 2 nights ago? You were on like 2 or 3 nights ago?
Yeah, I think it was a couple days ago.
I caught that. I caught a little bit of that. Very good job.
And thank you. To Kevin. Kevin's the one who was in charge of that. Somebody touted that study yesterday to me from the New England Journal that they were kind enough to share all of the names of the people involved in the study, and I look at that, and that raises another question in my mind, Kevin, about the validity of the remdesivir study, which is it's unconscionable to me that all the people that are listed as authors were actually behind the development and writing of that paper. So for all of those people to have their name on it, I think raises questionability of the legitimacy of there being authors on that paper. The people who write a paper are not that many people. The people who actually design a study are not that many people. That study, when you go to the NCT website and look at it, was developed by the National Institutes of Allergy and Infectious Disease. Those are the people that did the study. The fact that you're a doctor who has patients recruited into a study, that does not make you an author or a real contributor. It means that you're a doctor who has patients that was part of the study. They might as well include all the patients as authors at that rate. So that study is so sketchy that it's uncomfortable, and it is the promotion of misinformation. Remdesivir.
It's more than that, Richard. It's the fact that the mechanisms which are supposed to be in place that guarantee some transparency with science, so you can pick up a paper, are just being ignored and glossed over with respect to conflict of interest. If there's a conflict of interest, it can't be published, as you can't be on that paper.
Or at least you have to make people aware of that, And I guess I remember you asked me that question, and you can tell sometimes it's amazing how naive I still think as a scientist, because it takes me a while to sometimes appreciate what's truly going on, even in some of the questions being asked. And it didn't dawn on me until I think yesterday, as I was getting barraged by some of this stuff, that Fauci, this is an NIAID sponsored paper. Fauci is in charge of that. For there not to be a conflict of interest statement on that paper by Dr. Fauci stating, look, I'm head of NIAID. I'm connected with Gilead with this drug. That was a major, for that reason alone, the paper should be retracted.
Yeah.
and all the people that are listed as authors on that paper who clearly cannot be authors. They clearly were not involved in the research design. They clearly were not writing the paper. For that reason, the paper should be retracted. It's unethical.
Well, yeah, and the thing is, it's being used against the American public. It's not an issue else. It's not an issue here in Japan. But right now, people in the United States who are supposed to be looking up to those institutes which are there to protect the public interest,
right,
which are supposed to have mechanisms in place that stop the abuse of the system, has failed, and it's failed massively. And I can understand why people are they're swinging towards these sort of the extremes of ideation, and because it does look so corrupt right from the very get-go. So I can understand people then saying, well, why should we trust you with the vaccine when you've already failed the first step, which is try and do a proper study on remdesivir as an example, or the Regeneron.
Right. You know, one of the complaints I'm getting from the study I did was literally, this came back from one of the journals, it's too complicated. Wow. You know, look, I'm not asking you to repeat the study, although you're more than welcome to do it. It required a fairly sophisticated protocol to tease out the effects of the different drugs. That's how science is done. So for a scientific journal to say it was too complicated a study, tells me just how bad a shape the scientific community is right now.
Yeah.
And NIAID, NIH, CDC, HHS, Public Health Services, and the FDA have all failed miserably. Now, when they come on and say this is Trump's fault, I'm sorry. He's not a scientist. He's not in that. You know, whether again, I'm not interested in the politics of it. I'm interested in the science of it. And you know, I don't know how you can be at these agencies, and I mean, I think you'd have to resign at this point in time and say, I did a lousy job. We need to have somebody come in and do this properly so that we can get the respect back that we need to in these agencies. Because as a scientist, you've lost my credibility in these agencies.
I've just, someone in the chat says, what's your opinion on 9/11?
I was supposed to be in South Tower on 9/11.
Oh, okay.
Well, I don't want to get your stream taken down, so I'll just keep my opinions to myself.
You can. We take the risk. We had E. Michael Jones on here yesterday talking about dancing Israelis. So go right ahead.
I would say me and E. Michael Jones have similar thoughts on the government, because I don't like the move of saying a country, because that involves citizens that have no part in anything. So the governments and certain intelligence companies within the government of, I believe, Israeli, Saudi Arabia, and America were behind 9/11.
I mean, my opinion, yeah, for sure there was some planning. I mean, I literally look at it, and there's two things that I want answered, and they are questions from calibrated scientific instruments. Where's the seismic signal of those buildings hitting the floor? Okay. And what was the other one I wanted? The magnetosphere, right? So the magnetosphere has got huge deviations, right, at 9/11. That's Dr. Judy Wood's work. I don't vouch for anything else, but those two questions in my mind need answering properly. And why was there no seismic signal of hundreds of thousands of tons of steel hitting the floor?
Because there weren't hundreds of thousands of tons of steel that hit the floor. There wasn't anything left of that material by the time it reached ground.
That's what it looks like, and I've sort of stood by the view that was a demonstration of power and weaponry on that day, and we've been playing the game ever since because of it.
Did you notice that Bush was reading a book to kids when that happened?
Yeah.
Did you notice that the book was upside down?
Yes. Yeah, we've seen that. So
I don't know if Bush had any knowledge of when, how, or where this would happen.
mm,
I don't think
Deniable plausibility is a wonderful gift, isn't it?
I don't think he would have the capacity to be trusted by the people around him to have that knowledge before it happened.
mm,
I call 9/11, and this is, we may obviously are going to disagree. We may come from different backgrounds. I'm a religious man myself. I call it a binding and blinding spell. I think it was a spell casted out into the world.
Somebody thinks I'm going down a rabbit hole. Sorry.
I just think it was mapped out as a literal spell, a literal showing of what's capable and what's to come. And everything since 9/11 has changed as far as security, and we can even see the correlations from 9/11 to what we now see with COVID restrictions.
mm.
If you want to go color coding, if you want to go travel restrictions, if you want to go passports to be able to go certain places, they're even taking certain technologies that were made directly after 9/11. DHS was made because of 9/11. They're taking those same exact things and turning them into things for COVID.
Yes, the infrastructure has been put in place. I don't have any disagreement with that. Here's the concern I have with when you get to the edge of the boundary of this type of thinking, is that suddenly you can get into a flight of ideas with respect to you go down rabbit holes and you start to perhaps miss a bigger picture because you're starting to focus on smaller details. And let's step back and let's say that 9/11 was a precursor to what we consider the Great Reset right now. Okay, at what level do we have to say that planning stops and we're saying we won't investigate any further? And I can't answer that question in my mind. Okay,
my theory on it is people in power, elites, people above the elite, which maybe as a spiritual level, like I said, they have a lot of patience, and they have a lot more patience than we do. They can put a plan in place that they don't have to see to fruition. So 9/11 could be, this is just an example. I'm not saying it is, even though I may believe this is. This could have been something derived in the 70s that people that wanted to start the plan are going to be around for the end of the plan. They have a lot of patience in this regard.
Yeah, I wouldn't disagree, and I can tell you this from my scientific experience. Like I say, I haven't seen the shady men smoking a cigarette like X-Files, but perhaps Richard can sort of back me up on this. Within the scientific discipline, when you're at these meetings and you're talking about the results that you're seeing and where it's going, there are people there that have they hold the purse strings, and people are trying to jockey for that. One, to get the money, or two, to get into that position that they control the purse strings themselves. And I think that's a lot of the reason that the systems have broken down. And like you're saying, Davey, there's you could say that there's a overarching control or order that knows that level of control needs to be in place, and they have their hands on it. And
I'm saying there's an overarching level of control because Bush got into presidency name recognition. We understand that. Barack Obama was the baby in the manger that was going to be president. Trump got in, they say, because he's an outsider. Regardless of any of that, none of them are setting the policies or setting the lifestyle of the American people. There's people way more powerful than them that are handing down these instructions.
That's the oligarchy. That's what E. Michael Jones was calling out yesterday. I don't disagree with him, and I don't know.
And I'm sorry, I'm gonna have to cut out early because I have a stream at noon.
Okay, no worries.
I would like to say thanks for having me on. It was very nice meeting you, Dr. Fleming.
My pleasure.
I totally respect your opinions on everything, and especially because of your way more vast amount of knowledge on subjects like this than me, can inform me on things that I don't know about. And I will be rewatching the stream that you did with Kevin. And just thank you for your time, and I appreciate both of you guys, and I wish you both well, and hopefully talk to you guys soon.
Yeah, sure, dude. Anytime.
Thank you. Have a good day.
Yeah, you as well.
Yeah. Yeah, Kevin, as far as, who's got what, you have to remember, I think we've touched on this a little bit, when what I refer to as the JFK kids were selected, part of what we were asked was how we would respond to a lot of scenarios that were basically designed to determine who we would let die and who we would let live. And that we were being primed from the mid 60s onwards. So, who's in charge? It's always the same things, money, power, prestige, and the people that have it aren't going to relinquish it voluntarily. And that's why when you're in my scenario, you get used to the idea that you're going to be attacked, you're going to be controlled as much as possible, so that you can be put in a scenario where they feel that they have that amount of control over you, one way or another.
But is it fair to say, because people sort of ask this and they think this about the medical industry, as much as there's the buddy meetings, backslapping, etc. I've met with the head of Medtronic and other medical device companies. I never saw anything that suspicious. It was more just seemed like basic politicking and how would you say it? Like pandering. It was always pandering, it seemed to me, to sort of jockey for position. And
yeah, well, I'd call it manipulation, but same thing.
Yeah.
It became very clear to me with the one big pharma drug company that literally lied about how its radioactive isotope worked. And I tried to give them the benefit of the doubt by saying, well, maybe you just don't understand it. You haven't done the studies properly in the right sequence to see it. Certainly, if I make you familiar with the sequence of studies, you'll be able to look at that and go, oh my God, look, wow, okay, look. And then you come up with a better idea. And it wasn't in my case because I was intentionally trying to prove that. I mean, I was literally responding to some of their requests initially to try to use their isotopes for, in particular, breast cancer. And when I coupled the breast cancer and the heart disease work together, that's when the other stuff got exposed. And they were not at all interested in that. They weren't interested in fact, as far as the breast cancer was concerned, the one thing they told me was, we don't have a marketing scheme for breast cancer, so we don't really care about that, even though that's why we got you involved. We want you to promote our drug for heart disease. Well, now I can't do that the way you want, because you're telling people they need 2 radioactive doses to do a study when one will do it. So you're exposing, people to, as it turned out, 3 million curies of extra radiation and $20 billion of additional sales, and 100,000 people a year misdiagnosed with critical heart disease, telling them they didn't have it. So in some ways, you'd like to believe that there's this just typical business approach of pandering, but in the end, when you start looking at it and the further you get into what's really going on, there's really an absence of caring about the
the
medical
individual.
aspect. It's
Yeah.
it becomes the power and money and prestige, and they will take down whoever they have to do and do whatever they have to do to make the world continue. So, vaccines are, going back to that question, I have to look at that in that context and say, what is the motive? What is the intention? And when you have people that are non-scientists, like Gates promoting it, and you have Fauci covering up his conflicts of interest and driving the directions of research, I look at Trump saying, we're going to have a vaccine very soon well, I doubt you're smart enough, just to be frank, to understand, Mr. President, the scientific aspect of this, and you're being duped. You're being used as a tool by these individuals to get what they want, and you're thinking that you're using them to help cover your rear end in this pandemic scenario. So it's not that there's a bunch of nice people just accidentally doing something wrong. I don't buy that anymore. I always try to give somebody the benefit of the doubt when, but the longer you are familiar with the details and the longer you see them lie to cover up, and when you see people intentionally do things to cover up, then, at least I cannot then say, well, it's just an accident. No, it's intentional, and I don't think they really care. I mean, they developed something that they didn't expect to be. I don't think they expected it to kill the number of people they did. I think they were intentionally trying to see what they could do to increase the infectivity of the virus. Now, why? I don't know. I'm not in their brains.
Vaccines.
But I don't think
they're trying to make vaccines. I think that's what it was. They want to.
Yeah. I mean, it's hard to know, but it's certainly not because they were caring about the people that are voting right now, or the people in the world that are being locked down. This has been mishandled from day one by absolutely just about, I better caution that, everyone.
Yep.
And when you present findings of the research like we have to papers, and the comments are, it's too complicated to follow. Well, I'm sorry, you're a scientific journal, a medical journal, trying to present the topic of the year, possibly the decade, to your readers. I would think they would want to read that. I would think that they would, in fact, I've told people that I even have the redacted raw data for anybody who's a scientist or physician involved in SARS-CoV-2 to look at, first off, just to satisfy people, to make it available. And number two, to me, is the potential of somebody looking at the data and going, did you notice this pattern? And come up with something that I haven't seen, because I'm not going to pretend that everything in there to be seen is that I saw. That just doesn't happen when you get so close to the research. And patterns start to emerge, you suddenly start focusing on those patterns and that recognition. What if there's another pattern in there that I didn't see?
So what it's 20 to 2 in the morning for me. There's a couple of questions here that I want to get your opinion on. So Rock Girl is asking, what about thermography for breast screening? Guess that's a yes or no answer.
No.
No? Okay. No. Quick answer. And the second has been, what's this main goal of these executives? That Richard is right that at that level where they're talking the sales and profits, that the individual patient doesn't come into the equation, right? This I've seen, okay, but I would say it doesn't. I've never seen anything say, oh, we need to put an adjuvant into a vaccine for this specific, nefarious manner, for example. I've never seen anything like that, but I've seen what Richard is talking about, which is this: they're talking sales, and they're prepared to skip over what could be potential problems because they're fixated on one thing. And to me, that's kind of just a human trait anyway. You'll find that everywhere,
except for Kevin and myself.
Well, you know, I haven't been offered billions of dollars in cash yet and shares, so I might spin on a dime on that one.
Oh, you're not grifting here, are you?
Well, I'm just saying, I'm any executives listening to this, if you don't want me exposing your sketchy science, you can reach me, Bill.
No, that's not how they address it, Kevin.
Look, I'll say this, right? I've sat with it wasn't the head of Medtronic. This was it might have been head of Asia. We were in a conference. It was a small conference, basically Mayo Clinic, Seoul National University Hospital. So it was a small enough group that everyone could sit down and talk across the table, and there was minimal. Everyone was on the same level, and I had. They're starting to use a protocol where they put the deep brain stimulation into limbic regions to control addiction-like behaviors or neuropsychiatric problems, and I've seen that be ruthlessly deadly in animals, and I know it's happened in my animals. I know it's happened in other people, the monkeys and pigs. I'm pretty sure the same would happen in a human, and it's literally just dependent on the frequency. But they were like, well, you know, we're doing it. We're not having problems, and but they'll carry on. There wasn't the wish to sort of say, oh, here's a couple of $100,000, please figure that out for what's going on. It was just ignored. And yeah, that's probably the most egregious what would you call it, the sort of averting one's eyes to actual data.
Guilt by omission.
Yeah, I mean, so, you know, there was around this SARS-CoV-2, there was expert on, I want to say HIV, but he was involved in Winnipeg, BSL-4, plus the Wuhan Institute. He had one of these stimulators in the nucleus accumbens, and he just switched off. They said it's a heart attack. And the thing is, those programmers are remote controlled programmers, and you can program them to put whatever stimulation frequency that you want in there. And it doesn't take long if you're in the right site to just decide. The only way I can describe it is like an autonomic collapse, but everything looks healthy. There's no obvious like clot or bleed or anything like that. I think it's just the dysregulation occurs with the stimulus into the brain, and it looks an ideal way to if you're a troublesome individual and you have you know, they put it in, and look, China is implants more of these devices than any country, probably all the other countries combined. You don't hear about it. They don't really publish the studies, but they're putting these devices into the brains of individuals, and yeah, it's a concern. But I don't know what I can do. I tried and didn't succeed, and that I have to live with, I guess.
I'm sorry. What's the raccoon squad?
It's a sort of in-group joke that if you look at the YouTube page, we have a little raccoon and
with a gun. I've seen this is one of the Avengers thing, I think, or something.
Yeah, and so one of the people we sort of pick fun at, he's this guy who's well, he sort of came on and he was pretending that he was a Harvard medic, and then he was sort of trying to make a name for himself on sort of YouTube. And I spoke to him at the beginning because I thought he was from Harvard, right? And I didn't check his credentials. Then we sort of did a couple of streams together. I found out who he was and his interaction. And he was actually, he's in his 50s, just doing a pre-med. So he's sort of part-time pre-med to get onto a med course at Harvard. And the idea being, but the point being is that he was streaming as a Harvard medic. I mean, whether he was saying he was a student or not, but like I say, he hadn't even begun the medical courses, and so we take the mickey out of him a lot, and he tried to sort of do the same back, and he called us a raccoon, and we just turned it into a funny meme. And
I've seen it. I see the. I've seen it occasionally where you have that. I didn't know what the connection was. Yeah, you know, pre-med's such an interesting thing because it's not like you can prescribe aspirin. I mean, pre-med is not a degree. No. Pre-med is, I'd like to get into medical school. Well, okay. What's your degree? What are you going for degree-wise?
Well, this was part of his scam. So he did have a PhD in finance. Right, so that entitled him to call himself doctor, right? So he was calling, right? Yeah. So he was calling himself Dr. Paul Cottrell, that was his name, and then LARPing as this doctor from Harvard, right? And you had to scratch down and find out that no, he's not a medical doctor. He's someone just trying to get in and pretend to be, and he's trying to. You know, he's trying to get super chats, and this is the worst thing. He sells things like vitamins, colloidal silver, all sorts of crank.
My favorite approach for killing somebody with with SARS-CoV-2, give them silver, give them a heavy metal that will build up in their fatty tissues of their body, but not do a thing for the virus.
Oh, this is what they were touting on their streams, to nebulize this nano silver solutions and breathe it in. Right, so you're protecting the silver's gonna kill the virus and leave you unharmed. And it was the most absurd reasoning that this silver ion is just going to target viruses and not any other tissue. Was just it's a bizarre.
So I doubt any of your listeners will then be gullible to that because they're probably listening to you. But should somebody just be tuning in, let me guarantee you that nebulizing silver into the lungs is introducing a foreign material that the body will develop an inflammatory reaction to, which would only make the problem worse. And there's nothing in the receptor or replication pathway of the virus that would be interfered with by a cation like silver.
Well, the idea is just that the cation is enough to break down the structure of the virus, but if it does that to a virus, it's doing that to all protein and
I mean and that's and we've probably touched on this briefly. You know, one of the things that I wandered across in the preparation of both the writing of this book that we're still trying to get published, as well as the research, is that several of the drugs that are you know, the antibacterials like azithromycin and doxycycline and clindamycin work not only because they interfere with the replication of bacteria at the ribosomal units, which are smaller in bacteria than people, but they also work in the ribosomes of people. And Big Pharma, one of Big Pharma's selling points is that the antibiotics don't harm human cells because they don't affect human ribosomes. And it turns out that that is completely wrong, because there were some studies done that with Zika virus that showed in human glial cells that azithromycin actually interfered with the replication of Zika virus. So we know that they work in yeah, my the idiot single page image of walk the clinician and anybody else through the steps of how you should be looking at this virus. Yeah. So I don't know if you want me to comment on that a little bit, but it's important to look at this virus not only from its initial attachment and replication, which is what I would call the pre-hospital stage, because everybody runs through these you know, the rhinorrhea, the runny nose, and the fever, and the myalgia, ZX, and the pains that occur with viral, what's called a viral prodrome, which is just simply the symptoms associated with any virus. It doesn't tell you which one it is. It doesn't tell you whether it's a bacteria or anything else. It just tells you your body is responding to it. And in the initial stages of this, you want to be looking for something that inhibits the attachment of the virus to either the ACE2 receptor, the sialic receptor, the transmembrane receptors, or a couple of the other receptors that it's known to bind to, but aren't talked about as much, and to then inhibit the replication of the virus, which has to use the genetic material of eukaryote or human cell or primate cell, or something that has the genetic material to allow replication of the virus. And some of the things that are included in this chart was what happened to our common sense approach to treating pneumonic or pulmonary respiratory problems, which is giving medications that relax the airways, that decrease the mucus that develops, to allow an improved clearance of the virus and anything associated with it from the body, with a cough and a sneeze, and you know, the things that we worry about transmitting it, but it's how your body can get it out of your body. That's why you cough and sneeze. To remove it, and to consider the use of these medications just like we would any other time that this problem came across. And if you look at the National Clinical Trial Protocols, you can see that these other 3,000 studies aren't even incorporating these basic fundamental ideas.
So I have the treatment protocol
right
on the
up
screen.
there on screen. Right.
So people that are listening, you know, they're not going to be able to get hydroxychloroquine straight away. What could they have at home to be somewhat supportive to minimize the effects from infection?
Well, probably sublingual zinc lozenges, number one, would be helpful. There are curcumin, is that it? The over-the-counter stuff that Zelenko frequently talks about. You know, the basic bottom line is that what you want to do is kind of help the body address this. And we did touch on this during the last conversation that we had, which is you can't go out and buy sub-Q heparin, but you could certainly use aspirin.
So a question that came up because I've been advocating have aspirin to hand, but there are people saying, what about if someone has GERD? What do they do? I would say take your medication for GERD and take the aspirin, but I'm not.
Yeah, well, you know, there's a couple different things on that. First off, yeah, you know, if it bothers me that I have a gastroesophageal reflux disease, and the acid from the stomach is coming up into my esophagus and irritating me, but I'd rather not have that and maybe die from the virus. You put it in that light, you go, maybe I'll do something about the virus. So number one, there's that. As a cardiologist, when I was in training as a fellow, we used to have people coming in having their MIs, or again, what you call heart attacks, but they're different. And one of the first things we would do would be to try to get aspirin in their system. Well, a lot of people would give you aspirin and say, swallow the aspirin. Okay, well, that's going to take a half an hour or so to dissolve. Some people would grind it up with a mortar and pestle. What we did is we dropped Alka-Seltzer into a glass because the major component is acetylsalicylic acid or aspirin. And so that immediately gets it into your bloodstream and gets it floating around. So you might want to try something like, Alka-Seltzer. I'm not selling a product. I'm just saying, think about different ways to get it in your system. It's also true that you can take it with some with some foods. It's really not going to interfere too much with the absorption of the aspirin, particularly if you take it as, quote, Alka-Seltzer or some other similar medication. And again, once the aspirin's in your system, it's having the effect on your platelets on the thromboxane A2 for about a week, which is why if you donate blood, they want to know, do you take aspirin? Because if you're going to give them platelets and the platelets aren't going to work, well, it doesn't do them a lot of good to get your blood. It's true. You can't go around and probably get you can get some of these over-the-counter inhalers, but one of the emphasis that we have in this is that, a lot of inhalers also increase your heart rate. Well, gosh, we're not trying to increase your heart rate. We don't need to have people have, what's called palpitations or rapid fluttering heart rates. We want to work on the airways of the lungs. So that's why it's a beta-2 bronchodilator, because we want to affect the smooth muscle in the airways and the mucolytic component to minimize the mucus development, which makes it more challenging to move airway in and out.
So someone's just asked, a dose of aspirin can affect you for a week?
Yeah.
Really? That's
yep.
Wow.
It has that effect on the thromboxane A2. Now, obviously, the more you take, the more effect it has. And if you're somebody like me with my heritage and my background, you have to be careful about some of the things that you take like that. But if you're worried, then take a baby aspirin. We don't know what strength of aspirin works best for the heart. And I think I've touched on this before. There's not a cardiologist alive who's going to do this study because everybody's accepted that aspirin is beneficial to prevent heart attacks. So who wants to be the person to do the study that, well, we had 100 people and we gave 25 of them baby aspirin and they all had a heart attack because it wasn't enough. Don't I look stupid? No, so we're not going to answer that question for you. It's somewhere between a baby aspirin and 2 325 milligram aspirins. Yeah, go ahead.
No, I was just going to say that I do take aspirin. I've been taking it since I got ill at the Christmas just gone, and I've been using, I think they're 300 milligram tablets, and I break it in half, have one in the morning, one in the evening, and does help with the chest pain that I developed after that run-in.
All right. Well, it is probably 325, but yeah, not familiar with the 300 milligram one. So and frankly, let's get back to the basic thing, which is the reason why the people are having this inflammothrombotic response for the vast majority of them is the diet and lifestyle that they're living. If you are a smoker, you're going to constrict your blood vessels. You're going to increase the clotting tendency of the blood.
Except in this case, Richard, we've found that smoking is beneficial.
Well, so you get
light them freedom sticks, people. Light them up.
Yeah, so the cardiologist, yes, I understand what you're saying. It has acetylcholine component. I would argue that the cardiologist in me would just simply have to say, "Don't do that." I'm sorry, yeah. I can't separate that out dynamically enough to do that.
What about nicotine lozenges?
Okay, so there's an interesting thought. I don't have any information on that, but I recognize that might be a way to get some benefit without the cardiac complications.
Okay.
I'm not going to say go do that because I don't have any data one way or the other. And the first time I say, gee, that sounds like a good idea, everybody and their uncle runs out and says, Dr. Fleming says that I can do that. And I've been to way too many social events to not do that. One of the reasons why I avoid too many social gatherings pre COVID-19 is the fact that if I hear something at an event and I don't comment on it, it's automatically concluded I agree with it. And if I disagree with it and I and I oppose it, then I become an argumentative, annoying individual. So it's a no-win scenario for me. Or in movie land is a Kobayashi Maru.
Just reading for this thing. It is 2 a.m. I'm going to have to wrap this one up.
You need beauty sleep, and
it's not beauty sleep anymore. It's just not keel over with that heart attack whilst on stream, I guess.
There you go. What do doctors do for fun? Oh, I had a bad response I was going to do with that. I'm sorry. It's been a long time since I've had anything that I would call fun. So I guess for me, it's coming up and writing up the paper and seeing the end result. For me, that's fun. What do I do for sports and activities like that? I love to play tennis. I'm a scuba diver. I love to downhill ski. I can't understand why anybody would cross country ski. I've done that. It's like, no, that's no fun. So, I don't do what is it? The one board I forgot.
Snowboard.
I'm sorry. Yeah, snowboard. I don't do that because this is one of the few times I'll say, look, if God wanted me to do snowboarding, he would have given me one leg. I have two. I need one of these things under each leg.
Yeah, it's a young person's game, snowboarding. It's not for
when I first got back into skiing, the first time I was out, I had a really successful day and felt pretty good about it. And the last run I did, just for the heck of it, some snowboarder, some little teenage girl had fallen on her snowboard and was covered up by the snow mound above her. And as I jumped to go over the snowbound, she lifted up her snowboard, went over my skis, caught them, and I went flying. And they came out with the medics that they had in the area with their orange sled, and I'm upside down, and I'm literally doing what I'm running a review of systems of my body to see what I can and can't do, how much injury there has been. And this little girl is crying next to me. And my first thought was, where the heck are your parents? But she was crying and I just didn't have the heart to she didn't do it intentionally. So I was calming her down while doing this. They wanted to take me down on this orange sled. And I went, you've got to be kidding. I am not going down on one of those orange sleds. I'm doing this on my own power. And, so that was the first time I really got to see kids with snowboards. and it's, and I remember being in the chalet, getting all my gear off, and some guy was talking about this really fantastic thing they just saw on the big screen about this guy who went flying down the hill.
The famous.
And I'm like, yeah, I bet that was good. Snowboards, nope. That's for kids.
Yeah.
Yeah.
I agree. All right, guys, I'm going to wrap it up. Richard, thank you very much for coming in. And
thank you for the invitation.
Folks, it's on preprint server right now, Richard's paper. So if you want to read it and have it ready for your primary care physician, I probably would, actually. At least it's something you can study and have an intelligence.
I looked at it and I thought, oh my God, this is almost as boring as my thesis. It's got to be good.
Well, it's got data in there that it's hard to argue with. So
doesn't keep people from arguing.
Well, no, that's the nature of the beast, right? So, yeah. Guys, thank you very much. Share. I think there was some golden information in this stream. I intended it to be a short one, but it turned into a long one.
Sorry about that.
No. It's I like this sort of spontaneous people coming online. It means me actually doing less work. because I'm not sort of having to make stories out of tabs. And so anyway, thank you very much, Richard. Thank you very much, everyone listening. Take care.
Have a
God
good
bless,
day,
and I'll see you in the next one.
after the election.
All right, yeah. So I'll be up in the day. So yeah, I'll probably stream the election, guys, if I've got the energy. So
I voted last Friday.
oh, okay. I won't ask which way. So
Yeah, I wouldn't tell you.
okay. All right, so Richard, thank you very much. I'm just gonna quickly. I've got so many boxes open. So yeah, take care.
Bye-bye.
Bye.